Thank you very much. Can you hear me now? Am I unmuted?
Loud and clear, yep.
Right, very good. Thank you so much. And it's a great honor to be asked to be here and to be in a forum specifically with Peter McCullough, who I've admired very much from afar. And I've met Ryan and many of the others. But, very nice to meet you, Peter. Now, from my point of view, I'm an oncologist, which is a clinical oncologist. And it's been a bit of a problem because I've been dismissed when I've said sensible things. Oh, he's only a clinical doctor. But these people forget that I was there at the beginning with HIV. And I was there in 1984 when Fauci promised a vaccine in 18 months' time. And 40 years later, we still don't have it. So I've been through all this, and I was a co-discoverer of the CD4 receptor, which is how I got involved in COVID in the first place. That my colleagues, collaborators, with whom we'd actually done a very good HIV vaccine, and we've published and everything on it. Fauci continued to ignore it for reasons I've only just started to realize more recently. But we are asked to help do a vaccine along the same lines. And my first thing with vaccine is less is more. The less you put into the vaccine, the more likely it is to work. And everybody went for the spike protein. Now, when we analyzed the spike protein, we found it had, and we wrote this all down, we had terrible trouble publishing it. We couldn't publish it for 3 months. It was turned down by every journal. We found out there were 6 inserts plus the furin cleavage site. And the importance of this is these inserts all gave the virus a charge of a pH of 8 as opposed to normal of 6, which meant it was highly charged and acted like a fridge magnet going onto the fridge, really hyper infectability for human cells. The second thing that we did was blast analysis, and we pointed out the spike protein had 80% homology to human epitopes. And some of these were virtually 100%, like platelet factor 4, which would give you horrible clotting issues, and myelin, which would give you Guillain-Barré, etc. All these things have turned out to be true. We prepared a document, we gave it to our government here through Gove. I know it was discussed in Cabinet, went to Sage, Whitty and Vallance, and they all decided to ignore it. So that's where I came from. So I was furious about that because we knew there would be significant side effects. It was just how bad would it be? Well, step forward, we know that we had the problems, and Peter was the first to call the myocarditis, stroke problems, etc. And others came out with a variety of things. And when they started to roll the vaccine down to the 50s and 40s, I mean, I protested like mad and went berserk when they suggested giving it to children, when it was the average age of death was 82. I mean, the whole thing was like a dystopian Orwellian nightmare we were descending into. But what brought me into this group very much was the boosters. And I've done a lot of work in vaccines over the year, the Institute of Cancer Vaccines Immunotherapy, which I'm a principal of. And we have an adage that if a vaccine needs a booster, it doesn't work. And my goodness, does that never been more true than in this case? And patients who have been given these boosters, which I said were boosting against a virus that left the planet at least a year ago, and because it was a Coxsackie virus, anybody who's read the history of Coxsackie virus development knows you get a thing called antigenic sin or immunological imprinting. So it doesn't matter how many variants you vaccinate against, the immune system only sees the first virus that's disappeared. So it just produces lots of useless antibodies. But more importantly, the booster suppresses the T-cell response. And that's where I came in. I started to see in my melanoma clinic patients who'd been stable for years who suddenly came in relapsed. Sometimes the relapse was quite vicious. I mean, they had very bad disease. We had to retreat them all over again. And the only thing they had in common, we're used to severe depression and divorce, debt, bereavement, etc., suppressing the immune system and losing control of the cancers. But none of my patients had this whatsoever. They'd all been bullied by their GPs to have a booster just to be safe. And then I found that there were a lot of people coming down with lymphomas, leukemias, all of them had the booster. And I had 3 friends who only had the booster so they could travel after being locked down for 2-3 years. All 3 of them have relapsed and 2 of them have died. So we couldn't even treat these cancers. That was the other big rate. They didn't even respond to the standard treatment. So that is why I've got really, really vocal. I believe that using messenger RNA technology for infectious disease is basically a gross medical negligence. It really is criminal negligence, now knowing what we do. And it's even worse, the fact that every time I've raised it with everybody. I've been carpeted by the hospital, been carpeted by the Royal College of Physicians, told to be quiet and that I'm upsetting the patients. And I said, no, I'm not upsetting the patients. I'm doing my job. First, do no harm. And I am like the canary in the gold mine. I am seeing harm and we must stop now. So I'll just leave that as my message and a big stop there.
Dr. Dalgleish, are other oncologists seeing what you're seeing? You can't be the only one. And are they talking to you?
Well, first of all, my own oncologists in my hospital were horrified and told me to be quiet, that I was upsetting their patients. When I published my concerns and documented and said it actually fits because you're getting T-cell suppression, you're getting immunoglobulins switched to tolerization, what have you, I got contacted from oncologists all over the world. From Australia, from South Africa, from America, from Canada, South America, Europe. They all said the same thing. And they all said that they were told it was just coincidence or a selection of anecdotes and to be quiet. Now, this is what the problem has been with this pandemic. It is being Orwellian control and denial of the facts and the total prevention of debate. Science is debate till you come to the right conclusion. So following the science or scientific consensus, these are complete misnomers. They are absolutely incredible that we've had to put up with this. I've had plenty of doctors come up to me and said, I would love to do what you're doing. I would love to join you, but I've got a mortgage and 2 kids at school I have to put through. That's what's been going on. They've been going for the doctors that speak out. I don't care because I'm past my retirement age. So that's why I have no qualms whatsoever in shouting.
So one of the things we're definitely witnessing 4 years into this now is, again, government censorship. I've myself written more than 60 oversight letters to our federal health agencies. They're not responding.
Exactly.
They have certain way they analyzed VAERS, for example. First of all, they ignored the safety signals screaming at them at VAERS. They do certain analyses on there. They won't release those to the public. They won't release this to us.
Yes.
So we're not going to get the truth out of governments. And I think that's true globally. Maybe a few jurisdictions might be a little more honest. So seeing as you've had other doctors contact you, they don't necessarily have to put their name to it, but is it possible for people like you or a group to have doctors submit, basic their practice data that would show increases in cancers? I mean, would that be a possible effort that we can undertake?
There are certainly people I could ask, and I do know some of the people with the best data, are really bright clinical researchers who've got most to lose. I mean, one of the guys who was joining me, he basically had a phone call from the top saying, if you do this, you will never get another NIH grant ever again. That is the level of coercion that's been going on. That is his livelihood. And it was just incredible. I hear this all the time, the threatening coercion. This is not a free and fair democratic society we live in anymore. And we cannot allow it to continue like this. This is something we really have to put back in the bag and never let out again.
So I know one of the questions the organizer wanted me to ask you is, what should local government do in the Channel Islands? What would you ask that they do?
The first thing that I'd ask they do is ban all messenger RNA vaccines. Ban the whole concept of giving a booster, which is only there's no way in the world these vaccines prevent infection. We know that from the Cleveland study and many other studies. the more vaccines, the more likely you are to get COVID or some other dreadful infection, or zosters, Bell's palsy, shingles of other sites. It's just so obvious to any doctor that's seeing all this. So that's my first recommendation: ban all messenger RNA vaccines for the future, ban all boosters here and now.
But you understand one of the reasons that they continue to push the boosters, that's one of the techniques, so they never have to admit they are wrong. If they all of a sudden ban the boosters of the vaccine, that's a tacit admission that these things were not safe. They were not effective. So all the lies they've been telling us for years will be exposed. I mean, you understand that, right?
Yes, well, when I was at Andrew has had several parliamentary meetings, and I had discussed with somebody at one of these meetings. I didn't know exactly who he was, but he seemed to be very high up. And I said, "Why on earth is the government pushing these boosters?" And as coldly as you could like, he just said, "Well, they've spent such a fortune ordering far too many. They feel they ought to use them up." Now, this is even knowing that they're causing severe harm. I mean, it makes the whole thing even worse.
Have you been following the revelations about the DNA contamination, a different type of DNA contamination that is getting the cells, is getting the nucleus, and how that might impact increasing cancer rates? Are you following that at all?
Certainly am, and I've been writing in the Daily Skeptic and the Conservative Woman. Actually, I wrote one only yesterday or the day before on, where I listed all the ways that a messenger RNA booster vaccine can cause cancer. It's now up to 8 major described mechanisms. And the most recent one that is worth pointing out is, and Ryan Cole will know very much about this, is that the early studies suggesting the spike protein bound to P53, BRCA and MSH, etc., which are suppressor genes. So if you inactivate these, you can't control cancer. You're basically taking the police out, as it were, has been completely confirmed by a study from Brown University, where they show it's absolutely true. And that's another thing. This was shown a couple of years ago, but it was withdrawn and retracted under severe pressure from the NIH and big pharma companies. This is what's been going on. It's unbelievable. Now, that binding of those suppressor genes could lead to a tsunami of cancer in the next few years. Because if you've got an abnormality in the suppressor gene, you end up with cancer 10, 20 years earlier than you normally have had it. So I'm really frightened what the implications are for this. But the contamination issue you brought up means that there's no quality control. I mean, the MHRA go on about the importance of quality. They have made it very difficult for a very safe procedure about a heat-killed mycobacterium thing I've been working on with no side effects at all, but has been shown in randomized studies to be beneficial. They have stopped it being approved because they keep bringing up safety issues and quality control. There were no quality control safety issues, as we know from this contamination in the batches. I saw that a presentation out of the studies. It's absolutely appalling. As soon as that became evident, they should have banned it.
Have you seen the stories where government officials, the people in charge have been attributing the turbo cancers, some people are calling them, to accelerated aging? Do you want to comment on that?
Yeah, well, yes, there's no doubt there are turbo cancers and accelerated. Absolutely, I've seen it myself. I've seen 2 this week. I tried to do very little new practice, but both the patients and new patients I saw this week had basically had relapse and turbo cancers, i.e. very fast. And again, I mean, it's terrible. I said, "Can you tell me your vaccine history?" They both had not 1 booster, but 2 boosters, bullied by their GPs for them just to be safe, just to be safe. So there's many ways it could be turbo, because it upregulates PD-L1, which means you're protecting the tumor. I mean, we try to attack that and downregulate it with the latest immunotherapies, these Keytrudas and Optivos, etc. But it actually is activating pathways that program to escape immunotherapy and chemotherapy. And I've seen that in my own patients. I can't believe that their tumors didn't respond to standard treatments, and I knew it was due to the spike. Now I know a lot more reasons why.